Now, New York City will expand its coronavirus testing capacity by administering self-swab tests starting this week at sites across the Big Apple's public hospital system. The new form of COVID-19 testing, which allows patients to submit samples of themselves under the supervision of medical personnel, will soon be implemented at 8 places through New York City health and hospitals. New York City's Mayor Bill de Blasio
There is a better way to do testing, there is an easier way to do testing, and there is a safer way this week.
Previous tests required medical workers to swab deep inside a patient's nose, possibly triggering a sneeze response that could spread the contagion further. The self-swab test is a 2-step test that requires a nasal swab and saliva from a patient. This new way of testing is a better option to protect healthcare workers from exposure and also saves on personal protective equipment in the process.
They go into another room for privacy, and the patient takes something that's basically a sterile Q-tip, puts that in their nose. They don't have to go way deep, just enough to get a sample. They, forgive my bluntness, they spit into a cup, and those 2 samples provide enough information for the testing to be done.
This method and test seekers to keep a safe distance, reduce the need to devote healthcare workers to administering tests, and allow clinics to administer as many as 20 tests an hour instead of the current 15. New York City's Mayor Bill de Blasio also announced that the city will transform as many as 100 miles of streets to be used as open spaces in the coming weeks. So far, more than 5,000 people have tested at the city-run community sites since the 17th of April. The number of suspected COVID-19 patients in intensive care units across the city's public hospital systems is down as well as the number of people admitted. The percentage of people who tested positive for COVID-19 remained the same at 29% between